I'm part of something called Junior Doctors Essentials, which we're saying is a stepping stone to a safer future. And it basically is a project empowering and kind of a bottom-up patient safety culture for junior doctors. When you change jobs every 3 to 6 months, you don't know what you don't know, and that's an incredibly daunting prospect going into specialties. And you know, there's an increased risk of errors occurring, and that's a well-known fact. And inpatient iatrogenic harm still kind of runs at about 8 to 10%. So what we've done is introduce these credit card sized lanyards, which is actually these cards here. And there's 10 of them, and they're very lightweight, and they basically have key information on them. This is decided by patient safety leads, by focus groups of junior doctors, and by clinical incident reports. And all that information basically highlights the essential information that needs to go on these cards, and then they go out to the junior doctors, and the feedback we've had of them have been absolutely fantastic, with nearly all of them thinking that they're helping improve their patient safety, their clinical effectiveness at work, and especially in acute situations they find them really accessible and valuable to use. And we thought this was important to bring to the Patient Safety Conference, and also to see what else is being done to improve patient safety. Well, so far we managed to get through into the top 3 of the posters. I think there was about 230 submitted, and then we were asked to present to a room full of people who are junior doctors, other allied health professionals, managers, consultants, patient safety leads, and I think it's really important to platform the project to see if we can expand it elsewhere, nationally and possibly internationally, and I've met with some key people today who are looking to help us do that. So the key priorities are going to be progressing it out nationally and trying to develop an app for it, because although the cards are always going to be essential, an awful lot of people now are using app phones, especially if it's something that's not an acute situation. Then these are going to be really useful. So I think an app development is probably going to be our next step.